Hello, I'm Tarshia Lewis, and I am a patient here at Great Lakes Bay Health Centers. I've been a patient here for over 25 years. I'm a member of the board. I've been on the board for over 6 years now and had the privilege of becoming the assistant secretary. I'm very comfortable here at Great Lakes Bay Health Centers. I remember when I first started coming here as a young girl, I was nervous at first, but the more I came, the more comfortable I felt, and I started noticing that it felt like home. I remember one time when I had to come in, I was used to seeing women doctors. I had to see a male doctor, so it made me nervous. When the doctor came in, he must have knew I was nervous because he started joking with me and talking to me about things, and from that point on, I had a feeling that I never had to be uncomfortable again, whether I ended up with a male or a female doctor. It got to the point to where I got old enough to have a mammogram, and I was nervous because of the pictures that I've seen in brochures and stuff. So when I got in there and I was talking to the lady or whatever, and I told her how I was feeling, she made me comfortable again. I love that. I mean, I could encourage anybody that if they did come to me and tell me that they were nervous, I would let them know, you don't have anything to be nervous about. And it's a good thing to get done, because if they find something, early detection is the best detection. And I think that having the mammogram center here at Jane Street is very good for the women in the neighborhood, or if this is the place that they go, because we do have the transportation to get you here. Just being a part of Great Lakes Bay Health Centers, I wouldn't go anywhere else. Because the doctors here at Great Lakes Bay, they make me feel like I'm a part of the decision that they make. That's what I look for if I go somewhere else, and if I don't get that, I try to make sure I stay within Great Lakes Bay Health Centers, I feel like our motto here is that we do what we do for our patients because we really do care. And as a patient on the receiving end, I feel like that's what we do here. That's what the doctors do. Anybody that I've seen, the mammogram center, whoever, I feel like they care. I don't feel like they just doing it because it's their job. I feel like they really concerned. And I remember when I had a mammogram, my first mammogram, and the lady called me back in. I was scared again. She pointed out a teeny weeny spot that she was concerned about. The image was about as big as my head, so for her to point out this spot with the tip of an ink pen, it had to be teeny weeny, but to see that she cared enough to point that out to me, she made me feel like I'm not just here by myself. So when I went and got it checked and everything, it was benign, but still, just to know that something even that small, she was concerned. She could have just said, that's too little. Oh, it's nothing. But she didn't. She called me, she brought me in. She actually showed me. She let me see, she didn't just tell me. Everything still turned out okay, but it just gave me another sense of security to know that something that tiny meant so much to her. So it made me feel like, hey, we doing the right thing here. If I had to tell anybody, I would tell them, you might need to consider Great Lakes Bay Health Center, because we have so much to offer here, so much. Majority of my family members go here for numerous things. The eye doctor, dental, seeing your regular physician. So it's like family, and I love it. I wouldn't want to be nowhere else. And then the growth that I had. I got a phone call from the board, and I was shocked that they even considered me. Being a board member, I like the fact that I get to speak not only from a person in the community, that's the outside view, but I get to speak from the inside view as well. If I'm talking to somebody and they telling me about issues they might be having at their doctor, the first question I ask is, what doctor you go to? I try to get information, because if they a patient with us, then I can present it to the board and we can get some kind of resolution for them. So I'm a voice out there. I love it. I do, because it's like a double-sided yes. When my 6-year term was up, I didn't want to leave because it felt like family away from my birth family. So that's how I got the opportunity to be a candidate for the assistant secretary position. And I was nervous again. But I ended up getting the position, and then working with Jill Armentrout. She's helping me to grow because she got me speaking in front of people. I had to speak at the dial in front of over 200 people. So I cried, but once again, they comforted me. I love it. I just love it. I do. And I was like 16 when I first started coming here. And I'm 48 now, still coming. Wouldn't go nowhere else.